Good morning. It's Monday, July 12th. I'm Jessica Lovell. Welcome into the Morning Medical Update. Today we are talking exclusively about COVID-19 and, of course, maybe a little fly fishing with Chief Medical Officer Dr. Steve Stites. He is back from somewhere along a river in Colorado, so he's going to share a story or two, I'm sure of that. But before we get started, our producer Jill Chadwick, what an award.
Thanks, Jess. Good morning, everyone. Thank you for spending time with us last week as we began transitioning the morning update. And thank you most importantly for your feedback. To borrow a phrase we've used often in this pandemic, we are building the airplane as we fly it. And it might feel to some like we're flying through a little turbulence, that we've lost our focus for this update. Our focus remains the same: to keep the community safe and healthy. When the docs decided it was time for us to talk about other health topics, our team, we moved into action. But you know who didn't get the memo? COVID. So it's a little bumpy as we navigate the uptick in cases. And as your pilot, I thought it might help if we shared the flight plan. Every morning, we will always talk about COVID-19. We'll hear from reporters, and then on some mornings, we'll introduce a short health topic. So you, the community, have time to input your questions. So thank you again. Keep sending in your feedback. I love reading all of it. This is your update. We're on a big plane together, and I don't want to lose a single passenger. My hope is that you will remain seated and continue on this journey with us. Jess, let's get to the docs.
All right, Dr. Hawkinson, Medical Director of Infection Prevention and Control. Dr. Stites, hi, good morning. How are you?
I'm good, thank you.
All right, let's get to the COVID count. Dr. Hawk, what do you got?
Yeah, numbers have been going up, unfortunately. We saw that all week, last week, over the weekend, and now it's kind of spilling over into this week as well. But I think that coincides with nationally what we're seeing. And then, of course, in those specific infection hotspots, notably southern Missouri, Springfield area. Now we're hearing about Arkansas as well. Those areas with really low vaccine uptake. Here at the health system, we have 26 active patients with 9 in the ICU and 10 on the ventilator. We still have 13 in that recovery period as well, so a total of 39. So our numbers have been going up. We should point out that overall, in the totals, we have about only a quarter are vaccinated, so 75% are unvaccinated. In the ICU, almost 80% of those are unvaccinated as well. And we do have a wide range of ages as well. We do have 2 people in their 20s. We have a patient in their 30s who is unvaccinated in the ICU as well. So again, the theme is vaccination will significantly reduce the overall spectrum of disease and especially prevent you from having to go to the ICU.
All right, so lots to talk about today.
Yeah.
Before we get to all of that, Dr. Stites, welcome back.
Thank
How was
you.
Colorado? Great picks, by the way.
Thank you. Yeah, it was great. I have a little bit of advice for you, though. As the summer vacation schedule picks up, make sure you have a hotel reservation because we were driving back. We left Denver. Thinking we were going to, I visited some family in Denver Friday night as we were coming back, and then so around 9 or 8 or 9 o'clock Mountain Time, we decided, okay, we're going to start driving. We'll drive for a little while. We get past Lime. We're feeling pretty good. We'll stop at Goodland. No hotels in Goodland. And we checked in Colby and Waukene and Wilson and we went Hays, Salina. No hotel rooms, so we drove all night.
Oh my!
Now I haven't done that for a while, but apparently there was a girls' softball tournament plus the vacation schedules, and so every hotel room in western Kansas that on Friday night was booked solid, and we took shifts. We arrived in Kansas City at 7 a.m.
How many hours on the road?
Well, it was a lot because it was really 10 p.m. Central Time when we left. We got in at right 9 hours overnight driving in the rain, by the way, between Salina and Kansas City. So my most important recommendation to everybody is make sure you have a hotel reservation. You're going to travel and you're going to spend a little bit of spend the night on the road. I usually just kind of go, shocker. I just kind of roll and wing it. I wing it. I love doing that. And that didn't work out so well.
But Colorado's good. You and Mrs. Stites had a good time fly fishing.
We had a great time.
Good.
We were with another couple out there for part of the time, and we just love being outdoors. This is a picture of one of our guides and friends, Dustin Harcourt. He is Harcourt 3G. They're the outstanding fly fishing group out in western Colorado. A good friend. I've been fishing with him for over 20 years, and it's kind of like family going out and hanging out.
How many did you catch?
We did good. We caught a lot.
Good. Trout?
Yeah, all trout. We did catch and release and to put them all back. And, I always outfish my wife, but I'm not sure she would agree with that.
Right. Well, we're glad you are back. We're putting you back to work, though.
Yeah.
So hope you're well rested. All right, do we have any reporter questions on the line today?
Yes, good morning. Cody Holyoke with Channel 9. Welcome back, everybody.
Cody.
Hey.
As we talk about the surge in Delta cases and new coronavirus cases overall, it was interesting. The City of Independence is not requiring it, but requesting people to wear masks now indoors in public spaces, regardless of if you've been vaccinated or not. I'm curious your thoughts on this. Obviously, any mitigation is a good step, but do you realistically see other cities or towns doing this moving forward, and what would be the benefits? What are your concerns?
You know, Hawk, I would say that we have to be very thoughtful about this because we're seeing a significant rise. I mean, our inpatient numbers are up, but we were down to 5 at one point, and we're nearly at 40. And 7 of those patients have been vaccinated, just to say. And we got to do a little more research so we can talk a little more about what the profile of those patients is like. But, and we know with data coming out of wastewater looking in both Kansas and Missouri, the majority of patients are Delta variant. So I'm a little nervous. I'm going to be honest. I'm a little nervous about the rise in cases and about, I think we're going to have to talk a little bit more about wearing masks because of the large number of people who aren't vaccinated in our area. And I think that, plus that people are getting together more. It's a holiday. Everybody wants to go back to normal, and especially indoors. And I think we're going to have to think very carefully about whether or not, what are the right public health measures we're going to do. And I don't want to say we're ready to go back to masking all as a requirement indoors, whether you're vaccinated or unvaccinated. Yeah. But I do think we have to keep an eye on the number. Because I'll tell you what, if I was in Springfield, I'd be like, you guys got to go back to masking. Now, they've not done that. Yeah. But I'm a little nervous.
Yeah, I mean, I think it will continue to break down to those local community infection dynamics for sure, but also the vaccine uptake rate. Again, you can always individually assess that risk and protect yourself and wear the mask indoors. But we do understand that, again, the majority of these patients that we have in the hospital are unvaccinated. They are older. They are younger as well that are unvaccinated. So it's everybody. It's all age groups coming in. But it will be important to continue to identify, what is the vaccine uptake in that area, and what are you going to be doing as an individual. And if you feel like you are put in that uncomfortable situation, whether you're indoors around a lot of people, then certainly masking would be a reasonable thing to do.
Let's just put out there, the other thing that's going on is that, Pfizer is making noises about a booster shot after 6 months, especially for those who are immunocompromised or having other issues. And they talk about data they're going to release. Now, the FDA has been and the CDC are like, what are you guys talking about? Because our data shows outstanding protection against all things with the messenger RNA vaccines. Pfizer keeps saying we've got some information we need to present. Okay, well, let's see the information, guys, because you're talking about it. Let's see that information. And I think it's really important that we get our arms around this question about whether or not you need a booster, because like I've been saying, I don't think you're going to need a booster for a while, at least a year, maybe more, because there's pretty darn good antibody levels still in patients.
Yeah, and I think the key thing here as well is the antibody levels. Now, I think the boosters, an additional dosing, if they do pivot the vaccine to maybe optimize some of that antibodies that are created now to the new spike, could be important. But what we have seen, though, with these mRNA vaccines and even the Johnson & Johnson, they continue to offer good protection against the Delta variant. Why is that? Probably because of those T-cell responses. So I think we have been very lucky here as far as vaccination and developing both B-cell to create antibodies, but also T-cell responses, because we don't see that with influenza vaccine. We know that once you lose your antibodies, after that, say about 6-month period after vaccination, you really start to have a decrease in protection. But that is not what we've seen here. We have still seen very good T-cell responses, so very good immunity and durable immunity for up to that year, even with the current vaccines that we have.
So one other thought is, and this is one of those build the airplane while you fly at moments, let's see if the part fits. Does the vaccination in certain patients, will it need another shot? When I'm talking about certain patients, I'm talking about those. I mean, we have a transplant type patient in the ICU right now who had been fully vaccinated, and and it does look like the ones who are fully vaccinated have had other chronic illnesses. I'm wondering if a third booster will be important, or a third shot will be important in people who have significant other comorbid diseases. I think that's the question that we're probably going to have to examine most closely.
Yeah, I would agree, and I think the best data we have now are really directed to our our SOT or our solid organ transplant patients.
Yep.
Most notably kidney, liver, lung, heart, those types of patients with a lot of immune suppression. So that is where our best data comes from right now. And certainly recent publications out of the New England Journal of Medicine would show that it is likely beneficial to give that third dose. But again, there's been no specific guidance on that.
Any other questions on the line?
Yep, quick follow-up to that. Dr. Stites, you said 7 of the patients you're caring for have been vaccinated. Are any of those 7 in the ICU?
Yes, 2 are in the ICU. One of those is a transplant patient. Actually, the transplant patient was in the ED. So there are 2 in the ICU. And Cody, I think we're going to need to do a little bit more investigation into those 7.
Yeah, and we did talk last week about our patient population, and all of those patients did have those significant comorbidities with heart disease and lung disease as well. And again, there is another patient in their early 30s in the ICU, unvaccinated.
Yeah, unvaccinated. There's a whole bunch of those folks.
Yes. So it's happening as well, even if you're young.
Remember, out of 39 people, 32 have not been vaccinated. But we just want to make sure that we've got all the right advice that we can for folks who are being vaccinated, and especially if you have other illnesses that accompany that. And that's a part of the message we just don't know enough information about. If you're really immunocompromised, even if vaccinated, you know, we tell our transplant patients, you still need to be wearing a mask. You're supposed to be wearing a mask in public places before this pandemic. And even if you've been vaccinated, you still need to have a mask on in public places, because we know that folks like that are just, because they're on medicines to suppress their immune system to prevent rejection, which means they can't fight off infection as well. They gotta wear a mask all the time. And they don't all do that, of course, but that's sort of our recommendation to patients.
Yeah.
And then my last question was, we talked about in the winter how you guys had virtually no flu and RSV cases. One of my producers said that he's starting to see that among his kids' friends. I'm curious if now that all the masks are coming off, if you're starting to see an uptick.
Mm-hmm. Yeah, I actually talked to one of our pediatric colleagues last week. And she did say that, certainly in the clinics they are seeing an uptick in those cases of RSV, of those other common cough and colds. And she did, again, anecdotally directly attribute that to decreased masking overall. But again, we also know that in general, for the most part, respiratory virus season is, say, September to April, October to April, but we know that there are also circulating cold viruses in the summer and spring months as well. That's what we're seeing here, but we also had that reduced masking restrictions. So I think the pediatrics colleagues are kind of attributing it to reduced masking and just everybody getting together again.
I have a question from Fox 4, and you did mention this before, but just in case they jumped on late, I want to kind of re-ask it to you. But the CDC and FDA stated last week that Americans who have been fully vaccinated do not need a booster shot at this time. Reports say Pfizer suggests that booster shots will be needed within 12 months. What do you think people can expect in the future, and do you think it's too soon for the government to recommend booster shots?
I think it's too soon. I think what we want to see is Pfizer's data, because what Pfizer hasn't shown us is their information. They say it's going to be released soon. It's not been published. They've only made a reference to it, and I think that's one of our struggles is they keep making the references to it, but they haven't sent the data out there yet. And so we need to see that information as soon as we can to help start making those public health choices. Israel is saying they're going to move toward a booster shot, and especially in immunocompromised patients, and they've had a lot of Pfizer vaccination there. And so it's odd, because when you step back and look at it, you would say that there aren't that many breakthrough infections. But again, we're seeing some breakthroughs, even though it's only 20% or 25%. It's a little higher than I would have liked. But I suspect what we're going to find is a common thread. I think the common thread is going to be this. If you are really immunocompromised, you may need a third shot. There is a information, and granted, there's both humoral and antibody immunity here, so both T cell and B cell. But what we just don't know enough yet to fully understand and fully anticipate what direction this is going to go. But if I was a guessing man, so I'm going to take a wild guess, because why not?
Yeah,
just don't hold me
why
to
not?
it. It's COVID. Why not? Yeah, we'll say what we want. But we're not making it up. We're just saying, here's what you. The stuff about the transplant patients who got very little vaccination response after the first dose, and after the second dose they were like 35% or whatever, and then they got like 60% of what a healthy patient gets after the second dose of vaccination. says to us, man, they may, or after the 40%, the third dose, it got like 65%. So it says that there are probably some patient populations that are going to need a third shot. And I bet that's what we're going to find out. We just don't know enough of that story yet. And one of the reasons is that the other thing we know drives down numbers is masking and distancing. And so what happened is you already saw the numbers going down. You will see the numbers stay down for three reasons. One, if people are distanced. Number two, if they're wearing masks. And three, if they're vaccinated. So now we've taken off the first two filters. So now the only filter we're looking at is vaccination. And whatever things are left otherwise. I mean, I went to the grocery store over the weekend, and even in Colorado, where 6 months ago when I was out there, everybody had a mask on, right? Everybody was masked. Even in April, everybody was masked. Now, nobody has a mask on. And things have changed a lot.
Yeah.
And so I think we're seeing the effect of those changes begin to take hold. So you're not masking, you're not isolating, and not enough people are vaccinated. So, and you have a question you have to ask yourself with those who have significant chronic diseases like a transplant, even though they're vaccinated, how safe are they? I think those are the questions we're now asking, Hawk. And I just think we're asking a different set of questions than we did before.
Yeah, I would agree. I think you have to understand the spread of this disease in the context of everything else, that behavioral element. And that is unmasking, that is people getting back together, doing things, going to public places where they wouldn't have normally, restaurants, other gathering places, without masking and doing those things. And that just sets it up for spread. Now, if you are in those counties or those areas with 30% or 35% vaccine uptake, you are going to have a significantly susceptible population, and so that is part of the spread as well.
Yeah, I think Springfield's a lesson, right? Here you got people being shipped out of Springfield. They don't have any hospital beds because they are overwhelmed by COVID. And what's the combination in Springfield? All the restrictions are gone, and you don't have a very highly vaccinated population. I think the placeholder for all of us is the significantly compromised patients. If you had two vaccinations, are you fully vaccinated? Are you really fully vaccinated? And I don't think we know the answer to that question yet, and that's putting a specific group of patients at the highest risk because they also have the most underlying disease. We got to get that answer, and that's why we just need. Come on, Pfizer, get your data out there. Let's see what you're talking about.
Yeah, and another aspect of that tragedy is in these places with low vaccine uptake and surging cases. I don't believe it has really changed the vaccine uptake. It hasn't increased the vaccine uptake. There is still so much misinformation about there, vaccine skepticism, hesitancy. Most of these people could be prevented from going to the hospital if they were vaccinated. You can stop the surge in your community if you're vaccinated.
I totally agree. And I don't want my comment should be taken as, well, you don't like the vaccine. No. Vaccination is the only safe way out of this crisis, along with wearing a mask and keeping your distance. So we're trying not to do as much of the first two. Kids are supposed to go back to school. The CDC said everybody needs to go back to school. Yeah. Great. Then we need to keep people as vaccinated as possible. Vaccines keep you safe. The only question we have is, how much vaccination do you need if you're really compromised as a transplant patient is? And that's what I think we need to see the Pfizer and the Moderna data. And we'll have to follow what's going on in Israel, where they're going to offer, it sounds like, a third booster after 6 months.
We have another reporter on the line.
Yes, hi, Lindsay Shively from 41 here. I had a couple of questions. One of them, when we're looking at comparative vaccination rates in some areas, you look at Southwest Missouri, sometimes there are other areas around us where the vaccination rate may be only slightly higher, and yet we're not seeing the number of new cases like we are in Southwest Missouri. Is there another factor in Southwest Missouri or in these hotspots, or is it that each and every percentage point of people vaccinated can make that much of a difference? Like, what are you seeing? Why is it happening there and not everywhere where it might have a similar vaccination rate?
Hawk, I got a couple of thoughts. A, the Delta variant appears to be the dominant strain in southern Missouri, and we know that strain is highly transmissible. And so I think the effect of taking off the masks and then removing social isolation or distancing measures probably is especially important. I don't know what's going on in northern Missouri as far as whether it's the Delta variant or the Alpha variant or the original. And so I think that there's probably a story in there that we don't fully understand yet. But the Delta variant took off in Southwest Southwest Missouri. The second thing is there's a lot of tourism in Southwest Missouri. And so there, you have a lot more mixing of a population than you do in North Central Missouri. And the effect of Southwest Missouri between, Table Rock Lake, Lake of the Ozarks, Branson, and just, all the different recreational opportunities there, and in Northwest Arkansas, I think, is probably another part of the story. And a third part of that story is that in some of those areas, there's a fairly old population and a population without as much access to health care. So, and there's a lot of poverty in southern Missouri, especially southwestern Missouri. So you put all those things together, I'm going to guess that's probably a good part of the story, but we don't know enough yet to fully understand it. And I think that's part of why the CDC is now down in southern Missouri trying to figure that out.
Yeah, I would agree. I don't.
So the other question is, understanding that no vaccine protects anybody 100%, does the vaccine protect you from getting infected, period, in an ideal situation, or does it simply prevent symptomatic infection? Does that make sense?
Yeah. No, I can try and take that. So I think if we're talking about protecting from infection, if we look at that cellular level, that means the virus has attached to the cells and starts to create some sort of replication. For the most part, what it's going to do is prevent against the disease, the whole spectrum of disease. And we have seen this in good published data. It does protect against asymptomatic disease, but also that whole spectrum of disease of mild symptoms all the way up to severe disease as well. So more importantly is this vaccine is preventing the wide spectrum of disease, particularly paying attention to disease that you need to seek medical attention for, and severe disease and death as well.
All right, thanks, Lindsay. Okay, so on Friday, Colorado made the top 5 states for COVID-19 deaths, the CDC blaming the Delta variant. Dr. Stites, did you feel safe in Colorado? And then also, what's your advice for people who are still traveling if they don't know the vaccination rates?
Yeah. Well, first of all, anybody can go find the vaccination rates. The New York Times has that map they put out every day. It's open and free to the public. You don't have to be a subscriber to the New York Times to look at it, so you can find out the vaccination rate in that county. You can also see their infection rate in different areas. Did I feel safe? I was outside, and I always think outdoors is safer than inside, and we really didn't do a lot of stuff inside, just partly because of the way the day worked. We would fly fish from about noon. We call it noon to the moon. So you fish about 12 or 14. You're out there a lot. And in the morning, if we ate breakfast, there's twice we ate inside. But that restaurant still had really good distancing in place. There are other times we'd eat out on we'd sit outside and eat or take it back to the hotel room. So I did feel safe while traveling. But I'm also fully vaccinated, and I don't have underlying health conditions that are going to probably prevent me from mounting an antibody response. So I felt safe. I would feel safe just about wherever I went, whether I was in Colorado or not, because I am fully vaccinated and I'm pretty darn healthy, and I think, and my wife is the same way. I just think that's really the key. And so, also just to say, Colorado does have has a better vaccination rate than Kansas and Missouri. Is it as good as we want it to be? Probably not. Nobody is, except maybe Vermont. They're like 80% or 85%. That's really good, but the rest of us are down there and lower than that. So I did feel safe while traveling, but I tried to do right. And if I was going into a really crowded public place, and I still wore a mask, and when I went in and out of the filling stations and stuff, that's a funny deal. You don't know the people you're around, and you feel a little goofy. So I'd still wear a mask there, but yeah, by and large, I feel safe because I'm vaccinated and pretty darn healthy.
All right, you two. So we have some questions left over from last week, so we're going to get to those, and then we're going to get to some questions, Jill, from the community today. But first, the CDC updated guidelines for students returning to class in the fall, saying that if students are fully vaccinated, they should have the option to not wear masks. This is to both of you. Do you think this is good guidance when this is really on the honor system?
Hawkinson's the same advice it gave to the whole public, so I don't know how you would differentiate that in the schools. So if you go back in there and you parse it out, it's actually interesting, because I tried to read it over the weekend and it's different actually for the faculty than the students. If you look at the staff, they're saying 6 feet of distance. They say the students is 3 feet of distance, so they did differentiate a little bit about that based on age, and they do say if you're fully vaccinated, if you're not vaccinated, you should still wear a mask, and that's exactly the same advice as in the public.
Yeah.
I don't think anybody really follows that.
Yeah, no, I think that is important. Number one, it is important getting students back to school. But to your point, it is on the honor system. Are your children going to be vaccinated? We are hoping that children, either newborns or 6 months up to that 12 age range, will be able to be vaccinated soon. I think that will overall help, number one, the spread, but also help individually so those children aren't getting ill, don't have that risk of the multi-system inflammatory disorder as well. So we are waiting for that. Hopefully soon, vaccinations for children younger than 12 will become available, and that will help. That will protect themselves individually and also protect their classmates. Also be able to keep them in school, keep them participating in things. So that is important. If your children are not vaccinated, if you have children that are 12 and older not vaccinated yet, please go get them vaccinated.
And is it also safe to say that this isn't just about because the CDC's responsibility is the health of the public, and it isn't only then your vaccination or your COVID health, it's your mental health as well. And I think the other part of this statement that is implied, though not expressly said, is that there have been clearly mental health effects on students who were not in school, and you have to weigh those things out. And given the younger patients, that they do better if they get sick, but second of all, we do have vaccine available, and third, schools don't appear to be a place of spread now. They remove some of the restrictions, so we'll see how that goes. That, again, a little nervous about that, but I think we'll have to see how it goes. But I think it's also a statement about the mental health of young people needing to be back in social settings like school. And I think that's clearly this part of this. What the CDC is telling us is there were significant mental health issues for kids, and we need to address that. One of the ways to do that is get people back in school.
Okay, so why did the Department of Health and Human Services rebuke Pfizer for seeking FDA approval for its booster shot? Wouldn't a booster shot offer more protection?
Yeah, I wouldn't have used this term rebuke.
Yeah.
I think what they said is the CDC believes that the data is very clear. The 2 shots really are all you need and offers outstanding protection for the majority of people. I think that's true. What Pfizer is saying is we have data that makes us nervous that that after 2 shots you may need a 3rd shot, and a booster at 6 months, and plus we're going to reconfigure for the Delta variant. But nobody's seen that data yet. And I think that's the criticism is you guys are talking about it, but you're not showing it. So show us the information before you talk about it, and let us help you with that discussion. Now, the Israeli government has already moved ahead on that, and I don't know if that's right or wrong, because, again, I don't know if they've seen any more information than we have. So I think the problem is we haven't seen the information. And, people are out there saying, oh, Pfizer's just trying to make a lot of money. Well, Pfizer's already made more money than they thought they were going to make out of this thing. So I think that hopefully that's not the motivation here. Hopefully they're trying to do the right thing, and but we all want to see the information again. I do think this is going to come down to subclasses of patients, that we're going to have to start having different recommendations depending upon your overall health status as to whether or not you have a 3rd shot and whether or not you can mix shots.
Health status or age.
Yeah, you bet.
I agree. I think these are reports. The same thing is with Israel, it was a report, but in their report, although they only said it was 65% effective or something of that nature to infection, it was still 93% effective against hospitalization and death. So those numbers are still there. Again, we're all waiting for the full data, not just the press releases and reports. Will it offer more protection or more durable? Right now, what we have looks to have pretty good durability and long-lasting protection, at least for a year. Not only because of those antibodies, because we don't know the full correlate of protection of those levels of antibodies, but again, it's those T-cell responses, which I think we've been very lucky to see that we develop with this particular vaccination.
All right, we talked about RSV a little bit earlier. Many people are reporting the symptoms for the Delta variant are different and mimic RSV. What is RSV? And a lot of people assume that's just a child's disease.
Yeah. I'm not really sure about the anecdotes about people reporting certain symptoms. I don't think that's been borne out in the published literature. What is RSV? It's respiratory syncytial virus. And I think we should also note that this virus, RSV, has been around for a long time. We don't have a vaccine. We've tried to develop vaccines to it. It just hasn't worked. So I think that's one more piece of how lucky we are with coronavirus vaccines right now. But it is mostly a disease of children, but it does affect older adults or immune-compromised adults as well and lead to hospitalization. But for the most part, it is a disease, a virus spread amongst children.
And just to say that with the RSV, there's some things people are saying, gosh, we're seeing an increased cases of susceptibility. Because if you think about it, when everybody was masked, then you didn't really spread it. RSV numbers dropped off like went off a cliff, and so did influenza, went off a cliff. So now, is there a wider number of people, because they haven't ever had RSV, because we went a year without having people get it, so are there more susceptible people to it? I think there was some stuff I read again over the weekend. I was trying to get caught up, so I keep saying over the weekend, because I didn't read a lot while I was fly fishing. I'm not going to lie about that. So I had to read a lot all the weekend to get caught up. But there is a debate in some circles, and I think there may have been an article in Nature magazine looking at whether or not more people are susceptible to RSV right now than they were, because we were socially isolating and doing those things, wearing masks. And all that, I think, was absolutely the right thing to do. We may ask the same question about influenza, we'll see. But again, if you wash your hands, keep your distance if you're ill, and do all those things, you can make sure we all don't get RSV, which is good. Yeah,
and the most susceptible are going to be those youngest children, especially those newborns.
Which puzzled me, you'll know more about this, about the Delta variant. I understand that there's some data that suggests you don't have as much of a taste and smell impact, and so it does present more like a cold. RSV feels like a cold, though, right? And the COVID could feel like a cold, so I'm not sure about that piece of it as much, because you still kind of, sneezing, coughing, sore throat, that can be RSV. There's a lot of wheezing that goes along with RSV, and maybe that's one of the things about Delta variant. I've not heard that said, though. I don't know if you have.
No.
All right, next question. What do you think of the research out of Scotland suggesting your risk of hospitalization with COVID-19 from the Delta variant is twice the risk from the Alpha variant? Why is that?
Yeah, that was from that Lancet paper from late June, published out of Scotland. I think it showed a 50% increased risk of hospitalization or something of that nature. But it also showed that the people that were hospitalized and died also were not vaccinated. So vaccination continues to protect even against that Delta variant. There could be reasons. There could be reasons that maybe because we've also seen that Delta is more transmissible. Is it more fit? So are you replicating more virus? So you're expressing it out into the environment more. Are you replicating it for longer time? Is that why it's more transmissible? What are the other factors in the virus as well? It's not just about the spike protein, but it's other factors that help, say, evade the immune response or decrease the immune response that we saw in early data from the Alpha variant as well. So I don't think we have a good answer to that. Again, this is one study about the risk of hospitalization, but I think we continue to want more data. So we don't have a lot of more information of, does it increase your risk of hospitalization? Does it increase your risk of death? We are starting to learn that. That's certainly what one of their conclusions was. The other conclusion was that those people that are fully vaccinated were protected from that as well. So.
Okay, so the Delta variant hit stateside in March. Should we expect the new Lambda variant, which is confirmed now in Canada, to spread the same as Delta and be as big of a concern here by the holidays?
Yeah, I don't think so at this point in time. For one reason or another, the Delta variant seems to be outcompeting really every other variant or isolate in that region that it gets into. I think that there were, again, similar areas where Delta and Lambda were, but Delta seemed to outcompete it as well. So I think it's really too early to say. Right now, really, Delta variant really looks like the major variant of concern in the nation, and especially in those unvaccinated regions.
And I would just say, I think that it's not even clear that the Lambda variant, what all the downstream ramifications are as far as hospitalization and death goes. It's still pretty early. The countries where it's been now, it is in Canada, so we got to watch the Canadian data, because I think that'll be more like us to a lot of degrees. I think the Lambda variant, as I recall, came out of South America by and large, and I just don't think we know enough about that yet. But I'm with you. What I'm reading suggests that the Delta variant outcompetes the Lambda variant. So we'll see.
Jill, what questions do you have this morning?
We have some good ones. The doctors have answered a lot of them, but here's 2 or 3 that are not answered yet. Sean wants to know, is the Pfizer booster just for the variants, or is it also to protect against the Alpha variant?
Well, I think the answer will be that if you get a booster, it's going to be reconfigured around the Delta variant, but it's still going to maintain the properties and protect against the Alpha variant. And so it'll be a mix of it. So the booster won't be only for the Delta variant. It really will be for all things. And they're doing that because they say, Pfizer has said that in places where they've done a third shot, that it raises the antibody levels by 5 or 10 times what they were at 6 months. And so they think that's the highest level of antibody, and that's going to protect against all the variants. And so I think everybody wants to see the data that Pfizer is quoting before they speak to it. I think what the CDC and the FDA have been saying is, gosh, guys, we feel like we've got adequate protection. Why do we really need a third shot? Show us that information. But Pfizer is saying, gosh, we think there may be some concerns. This is my hypothesis, in certain populations that we know if we give a third shot to will really boost your immune system and really keep you safe. So I think there will be a discussion around that point. Are you safe enough, or can you be safer, especially in some subpopulations? I think that's going to be the real question.
Yeah, and I am not aware that Pfizer has changed their mRNA to be any of the variant spike mRNAs.
I don't think they've changed it yet.
The original
talking
one.
about it. Yeah.
We know Moderna, I believe, has pivoted to the 351, that South African variant, I think, initially when they had started to change some of their vaccine to look at if you need additional dosing. But I think Pfizer is still using its original mRNA construct to create that spike protein. It isn't a Delta or an Alpha spike.
Okay, Nadine wanted to know, did we mention Hayes? And Nadine, over the weekend, they went from 2 on Friday to 0 today. So if we don't mention them, I think the thinking is they're at 0. But we can.
But there were no hotel beds on Friday. Let's just say that.
Yeah.
That was also 0.
That was 0 too. That's right.
So another question that we had was, Pamela wanted to know, if a person is tested for COVID, do the tests cover the Delta variant? Mm-hmm. Is this a different test? So how does a person get tested?
Yeah, right now, as we have it here at the health system, we don't have any of those those tests that would allow for that S dropout or anything like that. So our tests still do diagnose the variants with high sensitivity and specificity as well. So
Okay.
no changes there.
Isaac's wanting to know what you think about. He's worried that if we go back to masking, that it will make the people that are not wanting to get vaccinated not want to get vaccinated even more, because what's the point? I don't get any benefit. I still have to wear my mask. What's your thoughts?
Well, you get benefit, you're a whole lot safer. Yeah. The other point is that even when we see some people being hospitalized with COVID-19 who have been vaccinated, we're not seeing a lot of death in that area. And again, we'll come back to that data once we get a little firmer grasp, but we have a little more information and we'll be real honest about it. But I think that I think you're still safer, number one. And so number two, you also still protect those around you, because the data is very clear that you're less likely to transmit it, even if you do get sick, if you've been vaccinated. So you do protect yourself, you do protect the people you care about in your community, Hawk.
Yeah, I think this goes to that individual as well, and we've seen it, and there are a lot of these individuals just continuing to be obstinate or losing the forest for the trees, creating their own narrative to support their opinion. This will continue to happen, unfortunately, and so we just, as public health people and physicians, just have to continue to give that message of get vaccinated. It will be more of a benefit to you. We've seen a lot of stories, if we're talking about anecdotes, we've seen a lot of stories coming out of the general media now about people that have been infected in those hot spots in those areas like Springfield, who now saying, well, I wish I would have gotten the vaccine. It's a simple thing to go do, and it would have protected them from those serious outcomes and from that illness. So we just have to continue to give that message of really get vaccinated for you as an individual. It will be much more benefit than any of the risks that we can have identified from the vaccination.
Can I just say, I love the way you said that, creating your own narrative to justify your opinion. I think my wife says I do that a lot, but I don't do that around vaccination.
Right.
I think every man might do that a little bit.
No.
Oh, Zinger.
Shots fired.
There we go.
Lilith has a question, and by the way, I love your name, Lilith. So pretty. She wants to know, how do you measure degrees of being immunocompromised? She says she has rheumatoid arthritis. She takes 2 immunosuppressant meds, but she says, I'm not as immunocompromised as a transplant patient, right?
That is a
great question.
and that is the big question, I think, on the table. What does it take to be immunocompromised? And I don't think we know that answer yet. I just don't think we have enough information. I think it's not the rheumatoid arthritis perhaps as much as those meds that you're on, and it may be the underlying disease. I mean, I think cancer patients are getting chemotherapy, you're compromised, transplant, you're compromised. I don't know which medications this person's on.
Yeah.
I mean, if you're on the real powerful ones like Cellcept and Prograf and prednisone, I think you'd have to say, well, that's pretty immunocompromised. So really, a lot of it comes down to which drugs you're on.
Yeah, that's exactly right. And we've seen that in the solid organ transplant literature. People that have a higher risk of not having those high antibodies have been on mycophenolate. So think drugs like that. We know that, say, if you have organ rejection, so you need to be on high doses of prednisone or other higher doses of those immunosuppressants, you're probably going to be more immunocompromised. So there are grades there. I think you should really talk with your prescribing physician to really understand that. But just as you said, down to that really molecular level, we don't have full answers of that. We just have general answers, mostly from that solid organ transplant literature about higher risk medications and not developing those antibody responses.
Here's what I would say. If you're at all nervous, and the same thing we would say, and we've been saying, I keep saying to my transplant patients, we've told you to wear a mask before the pandemic. We've told you to wear a mask during this pandemic. And guess what? We're going to tell you to wear a mask after the pandemic because we were telling you to wear a mask before the pandemic because you're truly immunocompromised and anything can be a bad thing if you're transplanted. So what I would say to somebody who's out there, first of all, make sure you're fully vaccinated because that clearly helps protect you. And none of us is good about wearing a mask all the time, right? Yeah. I mean, I think on the hospital side or in the operating room, we do that all the time. But in our personal lives, we don't, even as I try to be really compliant at the height of the pandemic, but I'm not going to tell you I was 100%. So vaccination clearly protects you. But if you have any doubts or any worries, wear a mask when you go out in public. And it's not comfortable, but honestly, I'd probably tell you to do that if you're really immunocompromised, whether there's a pandemic or not.
Yeah, I'm going out, and people on here are talking about how that people kind of look at you and maybe it makes them feel uncomfortable. I got to tell you, I wore my mask the entire weekend when I was popping in and out of a couple of stores that we visited. And my reason for doing it is I haven't had a cold, I haven't had the flu, and I sure as heck don't want to get COVID. So it is a personal choice.
It is. I wore a mask in the grocery store. There weren't many people, and I wore a mask in the grocery store because, it just made me feel safer.
I think they just like my mask, and that's why they look, so I'm happy with that. Angela, and a couple more questions. Angela and Stephen are wanting to know, it sounds like they've got children and grandchildren that have horrible, horrible colds. Should they get tested for COVID?
Yes.
Simple answer, yes.
Yeah. Because you want to know.
Yeah.
So here's the story. So last week, while I was gone, one of my patients, I was talking to Joyce, this is the person I've worked with so many years. She and I spoke a couple times, and before I'd left, there was this patient whose husband had been positive for COVID. She's a newborn, like 2 months old or a month old, not very old, right? And then she has I think it's like a 4 or 5 year old. And so husband got sick, he was positive, her 4 or 5 year old was negative, and she was negative. But then they got sicker, and so then they retested, and the 4 or 5 year old was positive. And now she's positive. So you got to figure the newborn's positive. And so you just think about that. So you need to know, because what you really want to do is protect everybody else around you. And you got to say to them, don't go to my house. Right? Don't come see my newborn baby, because if we have COVID in our house. You need to know that. It doesn't mean you got to have a scarlet letter and some big number on your forehead, right? What it really means is that you're trying to keep everybody safe. And so if you've got a bad cold, darn right you got to go get tested, because it's going to affect what you do and how we handle that and the safety measures you have to take and how other people have to take it so we prevent the spread of the disease.
Yeah, and I think from an isolation standpoint, if you're positive for COVID-19, then you're going to be isolating for those 10 days. But if you're not, and if you're otherwise feeling good and you're 24 hours from having a fever, you can kind of get back out into society and do what you need to do, just as that guidance was prior to the pandemic. So that's important, as well as maybe for your own mental health. I don't have COVID-19. That's great. My risk of blood clots or having long hauler symptoms is not there now because I don't have COVID-19. So that's important. It could be important for your mental and emotional health as well.
I'm so glad you said the word long haul, because the truth is that that long haul thing, we haven't said that out loud yet today. That's another way to why you want to get vaccinated, because remember that patients who are vaccinated aren't getting long haul very often at all. And number two, long haul can occur whether you're asymptomatic or symptomatic with COVID. And a lot of young people have long haul syndrome. And so I know we're going to be talking more about it, but that's a big deal, folks. Don't miss that point.
And we have so many questions, and I just want to say I'm taking this last one. Hawkeye's here tomorrow. Dr. Stites back on Wednesday. So I will get to these questions, I promise. Paula gets the last question. She says, thank you, doctors, for your measured and calm information. Thank you. She's over 60, and she hasn't had her shingle shot yet, and she got her last COVID shot in March. Would it be prudent to get the shingle shot now? I didn't want to overwhelm my system. I hope that makes sense.
Yeah, absolutely. You won't overwhelm your your immune system. Your immune system samples things from the environment every day. It sees pathogens or antigens every day that it is able to direct responses to, especially things that you may be inhaling in the environment when you're out walking, outdoors, gardening, anything like that. So you will not overwhelm your immune system. Right now, I believe the guidance from the CDC is that you are able to administer different vaccines together with the COVID-19 vaccine. So right now, especially if you had the coronavirus vaccine in March, you're certainly welcome to go get shingles vaccine. I would recommend you to get shingles vaccine.
And remember, we give you measles, mumps, and rubella together. And those are actually not one vaccine. Those are 3 different vaccines, and each have different parts to them. And we give you the diphtheria and tetanus things together. So we give you vaccination together all the time. It's okay.
Yep.
All right, great questions today. So just a quick note about tomorrow's update. The Pink Warriors, they are back in the water and ready to compete. This pandemic has been really hard on this group who knows all too well about overcoming medical challenges. They have some great personal insight about surviving cancer and COVID. Final thoughts, Dr. Hawkinson, you get us started.
Yeah, it's a new week. Our numbers are going up. We know the Delta variant is out there. It spreads much more easily through unvaccinated populations. Please continue to go get vaccinated. We still have a lot of the summer left, a lot of things to enjoy. Let's keep everybody well. Please go get vaccinated.
Dr. Stites, all you.
Hey, just like I did, the rules of infection control travel with you wherever you go, and they still keep you safe. You have any doubt, make sure you're vaccinated, but it's okay to wear a mask. It really is okay to wear a mask. I'm not trying to tell everybody they have to do it, but mostly I want to tell you, stay safe. And folks, you know how to stay safe.
Thank you both, and thank you all for being with us today. We will see you tomorrow.